I decided to start the MICOM conference in the late 1990s when evidence-based practices emerged as a movement in the field of clinical psychology. The conference is directed at clinicians and practitioners who are working with children with mental health problems in a variety of settings. And we've been doing that for about the last 15 years. One of the most impressive aspects of the conference from my perspective is the lineup of speakers that we get every year. We get the best people in the world in their given areas of research and clinical practice, and we bring them here all together. It's unlike anything that can be found anyplace.
This conference is one of the leading interdisciplinary conferences focused specifically on clinical child and adolescent psychology. This conference is for psychologists, clinicians, social workers, anyone working with children and adolescents that want to learn about the latest evidence-based practices. It brings frontline clinicians to learn from the internationally renowned experts that have developed the evidence-based treatments in child and adolescent mental health.
This particular conference appealed to me because we have some of the top researchers, but really committed to disseminating the information with a clinical bent, and so that was the reason why I chose to come to this conference. As a practitioner committed to providing evidence-based interventions to the folks that I work with, wanting to stay up to date with some of the new advances and making sure that I can serve our clients, our patients, the best possible way. Since I've gotten here, I've been sort of talking to different colleagues and just feel really energized about leaving here with actual clinical tips that I can apply on Monday morning when I'm back in the office. So I absolutely plan to come back and bring some of my colleagues with me next time.
So my role at the MICOM conference was as a keynote presenter. I gave a talk on optimizing cognitive behavior therapy for treatment of OCD, anxiety, and tic disorders. I really like this conference. I go to a lot of conferences. I think this has been fantastic. Amazing speakers. There's a real focus on translating scientific findings and research findings into clinical practice, so very clear clinical implications for the topics. I also think the attendees are very skilled. It's a nice mix of students up to very experienced therapists. So the discussion after the talks, the discussions and questions in the workshops has been really high level, and it's been a great learning experience.
I think it's a really well-rounded conference. I think they're really comprehensive in terms of targeting so many different areas of child and adolescent psychology. I do a lot of child anxiety work, so I was really interested to learn about child anxiety and autism, and also learn more about child trauma work, as well as family work. So I felt like there were a lot of really good targeted sessions and specialty sessions, and there are also just really a broad array of learning options.
I decided to come to the conference because it's definitely a great opportunity to meet new people, new researchers, and be up to date with the latest information in our field. For the past 3 days, it has been a great conference. In my opinion, we've learned a lot. I'm going to be able to use a lot of the latest research and strategies for different things in my daily routine at work. It was a pleasure to be here.